Welcome back to another edition of TCM Graduate TV. I'm Kent Stevczyk, registered acupuncturist. This is a very special episode. This is for the channel project. We are going to look at this amazing case study. I get to review case study number 1. Let's get into it. This case study is in regards to female, retired, 84 years old. Main complaint: has pain in her left shoulder, but mainly when she is reaching outwards and upwards. It is only in her shoulder area and only happens with movement. She has had it for about a month and it is better with rubbing and warmth. There are a few other secondary complaints. Arthritis in the wrists, hands, and fingers gets worse with cold weather. Pain is really bad in the knuckles when she wakes in the morning. Takes about till mid-morning before she can straighten out her fingers. On palpation, there's a lot of swelling in her fingers. Index finger pain, it feels like a stinging pain. Also has a trigger finger in her little finger. Always has cold hands and feet. Cannot remember when the arthritis started, but it was years ago. And movement seems to improve during the course of the day. So we've got two kind of tiers of main complaints. Now, this can get really, really long. This video could go really long. I'm going to focus a little bit on these secondary complaints, but we're going to focus mainly on the main complaint and talk a little bit about branch and root. So the chief complaint is pain in the left shoulder. Tongue and pulse. The tongue. Swollen and pale sides. Short and red tip. Hollowed out section towards the back of the tongue, quite deep. That could be kind of a spoon shape. That'll go with kind of our swollen. Lots of short horizontal cracks across the middle. And there's a short vertical line in the lung area of the tongue. Now, I just want to comment on this one. So if it's about here, it's likely a heart crack. It's likely kind of like a tip of the heart crack. Lung cracks typically look like teardrops. And they're more so in the lung area. So I'm kind of on the fence about this one. I didn't get to see the tongue. I could totally take Andrea from the channel project word for it that it is in the lung area, but it's most likely has to do with the heart. Pulse. Almost impossible to feel the pulse in all positions, so we would call this a hidden pulse. Now, what's quite interesting is the pulse was 56 BPM. This is quite slow. This is almost like an athlete's pulse. It was very, very, very active. And here we see that the patient is 84 years old. So hidden pulse and slow. So let's look at the chief complaint, the tongue and the pulse, and then what we will do is we will do differentiation diagnosis, 8 differentiation, chi blood, body fluids, and then other, just like you would have to do if you're writing the NCCAOM or the Pan-Canadian exam. So we've got pain in the left shoulder, and there's some clues here. It's better with rubbing and warmth. So we could probably say if I rub my shoulder and I'm causing some yang, it's probably a little deficient. So I'm just going to write XU, shu for deficient. And there's probably some cold in that joint. So I'm starting to think a little bit like cold B, which I talked about in the first couple episodes of my Strength of TCM podcast. Now we're looking at swollen, pale sides. So if we have a swollen tongue, this means kind of retention of dampness, phlegm, and it's often treated by tonifying spleen qi deficiency. So spleen, qi, and then XU for deficiency. I'm just trying to save some space here. Pale sides. So there might be some liver blood deficiency. Liver blood deficiency. It's a little short. So again, we're going to think blood and yin deficiency. So blood and yin. Shu. Red tip. Could be some heart fire. Always very careful with this one. The longer a patient holds out their tongue for you, the more red the tip's going to be. The short horizontal cracks are a stomach yin deficiency. And again, that short vertical line, and we're going to get into that, I'm betting that it's more of a heart thing. Again, just in my experience, when the lung cracks appear, they look like little teardrops on the lung section. The centerline crack is often to do with heart. Hidden pulse, just straight up deficient all around. And the pulse is slow for this age. So we would think maybe a little bit not enough yang. Again, XU deficiency, shu. So there you have it. There's kind of a little bit of a breakdown of all the things we're already seeing. We've got some cold B. We've got some spleen qi deficiency, liver blood deficiency, blood and yin deficiency, stomach yin deficiency. So blood, yin, yin. We're starting to see a pattern there. Maybe some heart fire. And no, there's a heart and a heart thing. So a couple heart things are kind of showing up already. And then we've got a hidden pulse. So just deficient overall. And it's a little bit slow. So yang deficiency as well. Before we get into a differentiation diagnosis, let's look at some of the other signs and symptoms that Andrea shared with us in regards to this patient. I'll put a link in the bottom of the video to the Facebook group where you can actually get this case study in your hands. Currently being treated for recurrent cystitis, which she has been getting for 18 months, was on antibiotics but had to stop as they would give her a real muzzy head and make her feel sick. Wears a hearing aid, had a heart attack in her 50s but was vague about it. She has something in her chest to monitor her heart. Might be a pacemaker. She's not sure at this point. So that was 34 years ago. So that's kind of interesting. We have a heart crack, possibly, and we've got maybe a red tip, and we actually have something physical going on with the heart. This is quite common. So let's say someone has had bronchitis 4 or 5 times in their life. There's a good chance that you're going to see lung cracks on the tongue. Long-term smoker, lung cracks on the tongue. Maybe someone has lost their son, so there's grieving and sadness, lung cracks on the tongue. So oftentimes the cracking will denote something very serious with the organ, whether physically, mental, emotionally. Has polymyalgia rheumatica, which is brought in by stress. Okay, so that's good that the patient is aware that the more stress they have in their life, the more pain they have in their life. Not really anything to do with urination bowel movements. That all looks good. Energy is 6 out of 10 most days. 84 years old would kind of expect low energy overall. However, we have seen many patients that are 90 and they're lifting weights and they're feeling like $1 million. Wakes up and is immediately quite busy and active around the house, cooking and cleaning. She falls asleep every afternoon after lunch for a couple of hours. Sounds wonderful. She really struggles to fall asleep and will often be awake until 3 a.m. despite going to bed at 11 a.m. So let's look at some of these other ones. So we've got having a problem falling asleep. So this is often due to heart blood deficiency. Again, XU, just using the Chinese just to save some space on the board. Shu. When she does sleep, it's very deep and will wake up about 8 a.m. She said she's really hot at night, but doesn't sweat. So hot at night would be kind of that. So like a kidney yin deficiency. Some gynecological things as well as some emotional things are kind of piquing my interest as well. So in regards to emotion, ruminates a lot on things and spends a lot of time worrying, has always worried a lot. So pensiveness, rumination, there's that kind of spleen chi deficiency. Gynecological stuff used to have 7-day periods, which were very tired and very draining. Remember the pale sides on the tongue? So some draining long periods. This very well could lead to that liver blood deficiency. Appetite seems good, likes cakes, likes sweets, those sorts of things. And then in regards to pain, we talked a little bit more about pain in the hands, the trigger finger, also has a lot of pain in her feet. Lots of swelling on her feet and lower legs, can hardly bend her ankles. When she takes her socks off, they mark and they leave a really, really deep indent. So I actually left this one for the top. So going back, had a heart attack in her 50s, could have something like congestive heart failure, those sorts of things. This will cause, in a Western sense, this will cause a lot of edema in the feet. Hands and feet are cold. There's another kind of sign and symptom of perhaps an actual heart problem. But of course, in Chinese medicine, swelling in the feet, edema, this can be dampness, but oftentimes it's due to yang deficiency. And we're going to get into that. Differentiation diagnosis. So what we're going to do is look at interior, exterior, hot, cold, excess deficiency, yin and yang. So let's look at those first. So looking at this case study, is it an interior condition or an exterior condition? And I know that some colleagues, and I remember when we were students, some of my student friends, they had a heck of a time figuring out if the condition was interior or exterior, and I'm just going to make it super simple for you. If there is a presence of a wind cold, wind heat, wind damp cold, wind damp heat, cold or flu symptoms, it is exterior. If you have a patient and they come in, or maybe your prof presents you with a case study and there's internal stuff and external stuff going on, then it would be both. Or if they present you with a case study and all it talks about is the wind cold that the patient is suffering from, it's exterior. So there's absolutely no wind cold, wind heat, etc. There's no exogenous pathogenic factor that we're talking about right now. So it is interior. Now, looking at the case study, is it excess or deficiency? Well, this one we could probably argue, and I should say that it's actually really important when you do this as a group, when you do this in a classroom. It's important to argue. It's important to say, well, I think it's this. No, I think it's this. I like this acupuncture point better. I found this diagnosis, because we learn from each other. Now, looking at this entire case study, there seems to be a lot of deficiency. You might be able to argue and say, well, there's dampness, and that's an excess thing. There's excess fluid. So we could say excess and deficiency. Or you might say, well, no, that dampness is actually because of that spleen yang, kidney yang deficiency that we're gonna get into. So I'm going to leave it on deficiency, but again, this is where you might have an argument, and a good one, a good conversation. Is it hot or cold? Again, very common to look at a case and find that somebody perhaps has joint pain relieved by warmth. We'd say, well, that's cold. But then they stick their tongue out at you and they've got red prickles on the sides and they're talking about their irritability. So that we say, well, there's heat and cold. Now, I'm not finding a lot of heat symptoms here, so this is pretty cut and dried for me. I'm going to go with cold. Here's the last one. We're trying to find out if this case is all yin or all yang. If the case is interior deficient cold, it's all yin. So I can circle yin, which I just did. If it was exterior excess hot, we would say it's all yang. 99% of the time, you're going to circle both. But what we're trying to do, again, we're just zooming out, looking at the entire case study as a whole to help us diagnose. So 8 differentiation diagnosis starts with interior, exterior, excess deficiency, hot, cold, yin, yang. So we've got some ideas. It's on the inside. We don't have to worry about doing a GB20 Li4 lung 7 combo to expel the wind cold. It's deficient. We're probably going to have to use, if you're into needle manipulation, you're going to have to set the mountain on fire. You're going to have to tonify. We might have to use some moxa. Cold, same idea. We're going to have to start thinking about that root fire, that kidney. Maybe we're going to have to use Ren for, Do for. Maybe we're going to have to use some moxa again. And it's more on the yin side. So again, we're thinking about maybe if it's more yin, it might be lacking a little bit of yang. Let's look at the next step of differentiation of diagnosis, qi, blood, body fluids. In regards to qi, blood, and body fluids, again, this is where you decide. No, Kenton, I didn't pick that. I picked something else. Fantastic. This type of medicine is a living art. So the disagreements and the finding middle ground between practitioners is what it's all about. We learn from each other. Super important to remember this. So when we look at qi, we're looking at qi in general, the whole body. So is there qi deficiency or maybe qi stagnation, that sort of thing? But we're also starting to talk about these organs, and we're kind of getting the zangfu organs in the back of our mind. Start thinking about them. And of course, there can be more than one thing wrong with qi, blood, or body fluids. So in regards to qi, what things can happen with the qi? Well, we could have qi deficiency. Do we have qi deficiency here? Well, spleen qi deficiency. We've kind of found some of that. So yes, we've got some deficiency. Is there anything else that we can say about the qi? Well, we could also argue that maybe the qi is a little bit stagnant. We do have pain. That's the main complaint. And at the very base of B syndrome, pain syndrome, it's qi and blood stasis. So we're going to say we've got some qi stagnation. Other things that can happen with the qi is they could be rebellious. We could have a patient coming in with acid reflux, and we would say, well, there's probably some qi rebellious qi that's happening as well. But that's pretty much it kind of for the qi. What can happen? We can also have like sinking of qi. Maybe somebody has an organ that is falling down, prolapse of uterus or something like that. And then we can say sinking of qi. So any of the vocabulary that we use with these terms like qi, blood, body fluids, you're going to start combining them. And again, this is why we do these case studies. It's to help you learn the language of Chinese medicine. Now, what can happen with blood? And this is, again, the language of Chinese medicine. There's things that can happen with qi that can't really happen with blood. Is there such thing as blood deficiency? Yes. Do we have it? Well, we've kind of determined that maybe there's a little bit of liver blood deficiency. So there could be blood deficiency. Talking about heart blood deficiency, that's another blood deficiency. Can there be stagnation? Well, going back to B syndrome, we could very well argue that we have qi and blood stasis, and that's why we have pain in the shoulder with this patient. Now, something that can happen with blood, we can have reckless movement of the blood, or maybe the channels and vessels, it's the spleen's fault, not holding the blood in the vessels. So those are other things. We could have heat in the blood. So those things we don't talk about. We can't have heat in the chi. We don't say that. That's not language that we use. But again, we don't have those things right now, but I want you to think about those things. So body fluids. So we're literally talking about is sometimes there's not enough yin or there's too much fluid like damp or phlegm. So is there too much fluid? Yes, there's some extra fluid. So we have kind of an excess of fluid. Is there any yin deficiency? Is there any fluid? Yes, we have like stomach yin deficiency due to the cracking on the tongue. And that's pretty much it. So we're zooming out, we're collecting information, we're kind of trying to get a feel, not a hard diagnosis, not yet, but like a feel of what's going on. So we did the 8 principle, now we did qi, blood, body fluids. We're going to erase this, and now we're going to talk about zong fu. Let's talk about all the zong fu that we think are having a hard time. And again, we can argue this to the death. And that's the whole point, to help each other learn from each other. So let's look at let's go through diurnal flow of qi. Let's talk about lung. Is there anything going on with the lung? Other than that, maybe perceived crack on the lung. Other than that, I'm not seeing any cough, asthma, breathing problems, sweating during the daytime, those sorts of things. There's no cold, flu symptoms, etc. There's not a whole heck of a lot going on with the lung. Large intestine. Again, not a lot going on in terms of bowels, that sort of thing. Lung, large intestine. Stomach. We talked about stomach yin deficiency quite often with small horizontal cracks on the tongue. Lung, large intestine, stomach, spleen. Found some spleen qi deficiency. There's also a possibility of a spleen yang deficiency. Now, if you have my workbook, you'll know that anytime we say something like spleen yang deficiency, we're inferring that there's a kidney yang deficiency as well. Lung, large intestine, stomach, spleen, heart. Large intestine, stomach, spleen, heart, small intestine. Now, kind of this cystitis, we can talk about that after. Lung, large intestine, stomach, spleen, heart, small intestine, UB, and kidney. Kidney, we're looking at kidney yang deficiency. Again, I'm going to argue the kidney yang deficiency is probably causing the edema, and it's also responsible for the cold limbs. We've talked about cold in the shoulder, which we're going to get to, but we've got cold hands and feet as well. So lung, large intestine, stomach, spleen, heart, small intestine, UB, kidney, PC, triple warmer, gallbladder, liver. again, looking at all these things, it's very common for a patient to come into our clinic and they've got so many things going on. And that's okay, because your job is to find out what is the most important thing, and the most important thing is the main complaint. Let's erase this. Look for anything else we can think of, which is usually other, and I'll explain that, and then we create our diagnosis. Before we get into other, I just want to touch base with this cystitis. And also, it might be a little confusing as to why I wouldn't say she just has spleen qi deficiency and a kidney yang deficiency. There was a dwindle in the appetite as well as there is cystitis. So cystitis is often blamed, and like I'm looking at all of these things and with my experience and just kind of zooming out, this plus low appetite is often spleen and kidney yang deficiency. Matt Choate has got a wonderful book called The Practice of Chinese Medicine. There's some really cool protocols that we're pretty much going to get into today, but kind of breaks this down, and this is why. So when I see kind of the cold limbs, cold hands, cystitis, decreased appetite, perhaps a little bit of a sallow complexion, takes antibiotics, can't really handle them, starts getting kind of like this kind of damp thing going on, I'm starting to think the spleen qi deficiency is starting to turn into a spleen yang deficiency, especially because there's a kidney yang deficiency present. So there's not a whole heck of a lot in terms of other, but I want to explain it. Other is where we would use 4-level, 6-stage, 5-element, those sorts of things, those sorts of diagnoses. For example, if we had this patient complaining about alternating constipation and diarrhea, and we found out there was liver qi stagnation, we could very well call this wood overacting on earth. If we had a water-fire imbalance, maybe between the kidneys and the heart, we could call it that. If we had a patient and they were just in the initial stages of fighting a cold or flu, we might say that it is in the Wei stage in 4-level. This is how we use these others. So just to summarize, we started with our 8 principles. And we determined that it was an internal problem. We determined that it was primarily cold, primarily deficient, and it's primarily yin. Then we went to qi blood body fluids. And we found that there was qi deficiency, qi stagnation due to the injury, or rather the pain in the shoulder. There was blood deficiency, there was blood stagnation, and body fluids. We found that there was too much body fluids, there's some dampness, some extra fluid hanging around, especially in the ankles and feet. And we also found that there is a stomach yin deficiency, there's a yin deficiency. So we did this one, we did Zong Fu. And I've got them written down here. So we found there was a stomach yin deficiency, a spleen qi deficiency, a spleen yang deficiency, heart blood deficiency, kidney yang deficiency, and a liver blood deficiency. And then in other, where again we can use our 4-level, 6-stage, we can use our triple warmer theory, we can use 5-element, not a lot that I'm seeing there. So let's erase this and we're going to come up with our diagnosis and our treatment plan. Let's review our diagnoses that we found, and then we're going to get into a treatment principle. So the first thing I found was cold joint B. So there's cold in the joint, gets better with warmth. The other thing I found was stomach yin deficiency, spleen qi deficiency, and a spleen yang deficiency. Remember, just to clarify the spleen yang business, is that the minute there's a kidney yang deficiency, I start looking for, has this been long term? The patient is aged. This very well could be a case where the kidney yang starts affecting other organs that are sensitive to yang. If there was a kidney yin deficiency, there would be other organs that are sensitive to kidney yin dwindling, such as maybe lung yin. You very well could argue that there's a heart yang deficiency here a little bit. So we've got spleen yang deficiency, we've got a heart blood deficiency I diagnosed, problems falling asleep, kidney yang deficiency we already talked about, and liver blood deficiency. So let's come up with our treatment plan. Now, if your patient ever comes in with pain, you're writing an exam or you're doing it in real life, the number one thing we have to do is relieve pain. We have to move qi and blood to break up that blood stasis and that cold that's in the joint. Now we start looking at our zong fu. We need to tonify stomach yin. We need to tonify spleen qi. We need to warm kidney and spleen yang. We also need to nourish heart and liver blood. All this work to zoom out, look at the patient as a whole person, and I start looking at these things, our treatment principles, and acupuncture points start coming out at me. So this, all the hard work is done. Now we get to do the fun part. And again, I got to reiterate, this is where you and I, if we were in a classroom setting, we would sit down and you say, I want to use this acupuncture point and this is why. And I say, well, I want to use this one and this is why. And nobody is wrong if you can justify it. If you can come up with like 2 or 3 really good reasons that you found in the case study to use an acupuncture point, it's all yours. Here comes the fun part, acupuncture points. And I'll even throw an herbal prescription in at the end. So let's look at the first thing we're going to do is relieve pain. Where's the pain? It's in the shoulder. We know which motions are causing it. So let's look at some really great acupuncture points for that. So I would like to use Li15 triple warmer 14. Also non-standardized acupuncture point, John Chen would be good. I would also absolutely love to use moxa to help warm and chase this cold out. And that's how I would treat this cold bee in the shoulder. Stomach yin deficiency. I would like to use the front mu collecting point, also influential of Fu, Ren 12, and the back shoe of stomach, UB21. For spleen qi deficiency, my favorite combination is spleen 6, stomach 36. And we can also think about the back shoe of spleen, UB20. 3 yin channel meeting, what doesn't spleen 6 do? And stomach 36, key or command point for abdomen, helps tonify spleen and stomach qi. In regards to the spleen yang deficiency, the best way to attack that is when we get to the kidney yang deficiency. Let's look at heart blood deficiency. Heart 7 stream source, very good. Does pretty much everything on the heart channel. And Ren 14 front mu and UB15 back shu, really good for that. Kidney yang deficiency. UB23 back shu of kidney, very good. Du 4 Ming Men, Ren 4 tonifies qi yin yang blood everything. It's also the front mu collecting point of small intestine, would be really good for that cystitis stuff as well. And very close to Ren 3, which is front mu collecting point of the bladder. We'll get to that. And kidney 7 tonifies kidney yang. Again, I would love to use moxa on some of this stuff. And we've got liver blood deficiency. So liver 8 is the mother acupuncture points, also the He, very good for tonifying liver blood. UB18 back shu of liver. You might like to use a liver 3. And now we can start adding some other acupuncture points. So Ren 3 for the bladder, help out that cystitis a little bit. How about that dampness? Maybe you'd like to add a spleen 9 to help drain the damp. Maybe you'd like to use a UB22, the back shu of triple warmer, to help with that dampness. You might like to add a C of blood, spleen 10, or influential of blood, UB17. Again, talking about that blood, there are so many options. There are so many things going on with this case study that you could say, Kenton, why didn't you talk about her pupils appearing really dark? Well, to be quite honest with you, that could be like a very much like a Shen thing. I wasn't there with the patient, and I don't know if they're not giving me that Shen, that vibrance. It's kind of lacking in the sallow complexion, swelling in the lower limbs, walks with a limp, but still with a little bit of a purpose, carrying a lot of weight around the middle, all that kind of stuff. So there's lots of things going on. And again, if this was a classroom setting, this would be a heck of a lot easier. But hopefully I've given you some thought in regards to building a point prescription. And of course, we're not going to use all these acupuncture points. I'm going to probably do, this will be on that shoulder. So it's going to be on the left shoulder. So 1, 2, 3. And then I really need to figure out what is probably going to be the biggest bang for my patient's buck. And I might say that I really want to treat that dampness and that kidney yang deficiency. So if I could have them sunny side down with their head in the headrest, then I can't do John Chen, but I could do these two, 1, 2, so that's 2 needles. And then I very well could do UB23, do 4. I could do a kidney 7, so 1, 2, 3, 4, 5. So I'm up to 7 needles total. And I could probably sneak in a UB22 if I wanted. If I wanted to treat the bladder on the back, I could do UB28. So there's 4 more needles. And I'm up to 11 needles. I like to keep my prescriptions anywhere between 8 and 16 needles. So you can kind of see how we could maybe build this out. Maybe you want to treat the spleen from the back. So we could do a 20. And there's 2 more needles. And you've got 13 needles. And you've got a pretty amazing balanced treatment. Speaking about herbal prescriptions, Jingui Shenqiwan. This will help tonify kidney yang, help a little bit with that spleen yang deficiency. I like to use herbs to kind of supplement that chronic root that we need treated in the clinic, where the acupuncture oftentimes is better for a little bit more branch or mild root conditions. Topically, I do like my Zhenggu Shui. Ice is for dead people, so using a warm liniment such as Zhenggu Shui is very good. Also for home treatment, you can sell a patient a bottle and they can apply it. Tell them to use the directions on the bottle appropriately, because what we're supposed to do with Zhenggu Shui is soak it right down to the bone, is to rub it right in or put it on some gauze and then slap it on the skin and have it really soaked down to the bone. So in the clinic, if I can use moxa, TDP lamp, etc., that's great. If I can use some Zhenggu Shui, but I'm also going to want the patient to do some homework and add some gentle heat to their shoulder as well. Andrea did ask for some dietary or lifestyle recommendations. One of the biggest things here is to stay away from any candies, cakes, sweets, anything that's going to cause more spleen, qi deficiency, and more dampness. We can also ask the patient to very slowly and gently put some warm foods in their diet. So ginger and cinnamon are very easy. Garlic, onion, salmon is warming. Talks about Matt Choach's Practice of Chinese Medicine, a very good book, and also Derek Leggett's Helping Ourselves, a guide to Chinese medicine food energetics, is a very good book, and that's a clinic staple, and it's my kind of cheat sheet, my go-to when I have a patient and I want them to adjust their diet and their lifestyle. So there you have it. This was a super big, amazing case study. First and foremost, I want to thank you for putting up with me for this long, watching this video. Hopefully I've given you some idea of what goes on inside my head. And probably most importantly, I want to thank Andrea from the Channel Project. Make sure you follow her on Instagram. She's doing great things for our acupuncture community. Thank you, Andrea, for allowing me to come into your space and do this video for you and your followers. This has been an amazing experience. I hope to do it again. And if you think that I got something wrong in the case study, go ahead, let's talk about it in the comments, and I'm sure I'm just going to agree with you. Just want to remind you that safety is king, bedside manner is king, and results are king in that order. Thanks for watching this video.